Hi, I'm Dr. Nikki Kay. I'm a medical doctor, clinical lecturer at UCL, University College London, and I'm the author of Hormones, Health and Human Potential. I want to talk a little bit about REDS, which stands for Relative Energy Deficiency in Sport. Before I go on and discuss this, I do want to stress that this is definitely not restricted to elite athletes. It can be, this situation of REDS can occur in any level of athlete, any age, male or female, and can include dancers as well. So before we get on to describing what exactly REDS is, just how would you end up in that situation? Well, this is where there is a mismatch between your energy intake, which is not sufficient to cover all your energy demands. Your energy demands in terms of the exercise you do, and in terms of the energy demands just to stay healthy and going about your daily life. This includes, of course, keeping your hormones healthy, so very crucial. If you have this mismatch, then you're in a situation of what's called low energy availability. And so what does the body do about this? Well, it has to respond, it has to adapt, it has to look for ways of saving energy. Just as when your phone runs out of charge, it has to switch off non-essential apps and go into energy-saving mode. This is exactly the same for the body. But when the body does this, this can cause adverse effects on both health and performance for the individual. And this is what REDS is. REDS is a clinical syndrome, as it's called, in other words, a collection of adverse effects of low energy availability. What are these adverse effects? In terms of health, many of the systems shut down or go into eco mode, and this is particularly for the hormones. For example, women, one way of saving energy is to switch off menstrual cycles because it takes energy to have this fluctuation, monthly fluctuation of hormones. So that's one example, but there are many others. Every single system in the body requires energy, so there will be adverse effects across a multitude of systems, reproductive systems, bone health will suffer, also soft tissues might be more prone to injury. So the list is quite long. But crucially for the athlete, they might have ended up in low energy availability because they thought maybe by restricting what they ate that this would confer a performance advantage. But what happens to the performance? Although at first the athlete might experience some really good performances in low energy availability, this is not a sustainable situation because the body will progressively shut down systems to save energy, and therefore ultimately the performance of the individual will suffer. And this is really sad to see, because the individual will not really have a fighting chance of reaching their full potential. And in fact, having health issues is quite a concern. So this does need to be addressed, which I'll discuss in my next little talk about REDS.